Welcome to the Dr. Carolyn Coker Ross Show, awakening your full potential and expanding your understanding of how to live fully and joyfully by making conscious choices that promote and maintain vitality in all areas of your life. Now here's your host, Dr. Carolyn Coker Ross. Please be sure to listen to this episode in an environment that is safe. Do not listen to this recording while driving a car or operating any kind of machinery.
Welcome to the Vital Life Radio. I'm Dr. Carolyn Coker Ross, your host, and today my special guest is Dr. Ralph Carson. Dr. Carson has been involved in the clinical treatment of obesity, addictions, and eating disorders for over 30 years. Well, he doesn't really look that old, though. His unique background in health science and medicine, coupled with nutrition and exercise, has prepared him to integrate biophysiological intervention and proven psychotherapeutic treatment. Dr. Carson has honed his skills in communication and often complicated science into enjoyable, practical, and informative workshops. He recently co-authored the popular book on nutrition and health called Harnessing the Healing Power of Fruits, and the soon-to-be-released The Brain Fix, Healing the Brain During Recovery from Addiction or Eating Disorders. Welcome to the show, Dr. Carson.
Thank you.
So
Happy to be here.
It's a pleasure to have you here. And today we're going to be talking about, a little bit about your book, but the title is the Changing the Addict's ED, which is eating disorder default mode, yoga, meditation, and massage. So tell me, when you talk about, I know you talk a lot about mind-body therapies, and that's what we're going to be talking more about today. What do you include in that topic, mind-body therapies?
Well, my background being in the field of nutrition and exercise, there's really three areas. One is that the psychotherapy component basically is designed to stimulate the brain in a form that most people would understand as rewiring the brain, or we would call it in neuroscience plasticity. And the second part is, once it's stimulated, to provide for its nurturing. In a sense, it's the nutrition part, and dealing with how nutrition affects this change in the structure of the brain. And the last part is basically when this all happens, and that is the component of sleep therapy, which basically the components of yoga are a big part of that.
Mm-hmm. Well, that's really interesting. I like the way you break that down. So you mentioned nutrition, which of course is a favorite topic of mine. You know, you and I are kind of in the same field.
Correct.
But you say that nutrition actually has an effect on the structure of the brain. Can you say a little bit more about that?
Well, yeah, I like to break it down in the sense of that the brain is similar to when we treat the heart. It's similar in terms of the brain, but the brain being the last part of the body to go, it's kind of like it hangs on, that it's the most important. And there's certain components of nutrition that a lot of times people don't connect with. And one of these is the fact that the brain needs energy, and its primary energy comes from carbohydrates and the need for good complex carbohydrates. And then the second factor, which I think is even more important, that's missed when we begin to refeed people in recovery, is the need for these omega-3s and to minimize the saturated fats and trans fats, because the brain is made up of these. I think it's fascinating to me that when we talk about even cholesterol, the science is totally different than most people understand, that the cholesterol that is part of the brain does not come from what is made by the liver. We have cells, 90% of the cells in the brain are called glial cells, and they actually produce the cholesterol, and they improve the synapses. So basically the whole recommunication of the brain depends on this very intricate balance of the types of fats in our diet. So it truly is, you are what you eat. And the last thing is that I think is missed, and we try to emphasize this in nutrition, is the emphasis on, because of these fats, many of them being unsaturated, can be very easily oxidized. And there's a lot of oxygen taking place in the brain, and the need for fruits and vegetables to provide these valuable antioxidants. So those are the big three components of nutrition.
Wow, that's a lot. It's one of the things that I just want to be more clear about is your second point about the fat. So you're saying, while many people, like cardiologists talk about the need to reduce cholesterol in the diet and reduce, cholesterol in the blood. Are you saying that the brain still needs cholesterol in order to function well?
We absolutely, and I think this is where I think we're definitely on the same page as we always talk about balance, and this concept of cholesterol is bad is not really correct. It's a balance. So there is a lot of data coming out now of this harm of having too little cholesterol, and I know when statins started becoming very, very popular, there was some concern that what would this effect have if you really get the cholesterol too low? So you have significant behavioral changes, significant changes in terms of erectile dysfunction. You have changes in terms of cognitive function. They even call it low cholesterol amnesia, and even high incidence of suicidal ideation. So we're getting concerned that we kind of don't take this to extremes. And when I work in the field of addictions and eating disorders, you have people who are extremes. So they'll go from one end to the other and get to that extreme where they want to get their cholesterol even too low. So I think it's this balance that we shoot for all the time.
Well, so does that explain some of the studies that we're seeing on using omega-3 fatty acids to actually reduce suicidal ideation? I know there was a study published in the American Journal of Psychiatry a couple years ago that showed that higher levels of omega-3 fatty acids were associated with decreased risk for suicide attempts.
And that's absolutely true. And that's, it's interesting. The way that I try to visualize or help people to understand is that most of the major communications that will occur in the brain are by basically neurotransmitters. So this is kind of complex, but I always try to put
You're talking about dopamine, norepinephrine, epinephrine, serotonin,
right,
those
right.
neurotransmitters.
So I like to think of those as sort of like pitching machines, like you're pitching a baseball.
Yeah.
And you're pitching it to a catcher, which is a receptor, and it's only when it's caught do you get a response. And so that these receptors have to be flexible to be able to go out and catch that ball if it doesn't come exactly to them. And that ability to be flexible is basically dependent on the fluidity you get from the omega-3s. If you start getting too much trans fats or saturated fats, that these receptors become very fixed and you get really poor response to the neuroreceptors. So a lot of times the way we attack this from a pharmacological standpoint, let's go ahead and make more of the neurotransmitter. Let's pitch more baseballs. But I think you can get a better balance if you kind of look at also trying to improve the receptors, and that's where these omega-3s come in. They improve the ability for the cells to catch the receptor, and therefore by having better connections, then you're going to have better responses, mood stabilization, all the things that basically lead to the prevention of suicidal thoughts.
And also they tend to increase the effectiveness of the serotonin drugs like Prozac and those using omega-3s, it seems.
Absolutely, and I'm getting some feedback from some people who are certainly practitioners in the field that the physician certainly needs to be aware that the patient is on a regimen of omega-3s because they may need to adjust those particular medication because they become more effective.
Yeah, exactly. So you don't have to take as much, and you don't have to get into the side effects of those drugs, of the prescription antidepressants, if you're on omega-3s. That's really very, very important information. And in our clients that we're talking about, people with a history of trauma, addictions, eating disorders, a history of sexual abuse, there are a lot of dysfunctional parts of the brain, and part of that is from nutrition, but there are also other changes in the brain that we can see on MRI. I know in anorexia there have been some studies. Are there things that you can say about those, what effect those things have on our brain, addictions and eating disorders?
Let me just hit on some of them. I mean, we do know, which is nice, we have now all these different types of brain scans. I know in the earlier years when we first started, all we had were what they call the PET scans and the MRIs, which are basically taking a snapshot picture of the brain or perhaps a moving picture. But now we have actually ways to see the communication between cells, and we can also see if there's an increase or decrease of the actual tissue, which we call gray or white matter. And so we do see in the anorectic population that this process of starvation causes loss of brain tissue. And it's nice that when we basically, if we do nothing else but refeed the patient correctly, that we have this regeneration of nerve tissue, so it increases. The issue is we need to kind of have this integrated approach, so we make sure that we're increasing the gray matter and not just the white matter or vice versa. So that's a plus, and this also is seen in many of the addictive states with cocaine use and heroin use. We're seeing actually increase. They call them a Volex type of image that we see increase in the different matter, the tissues. So this is very exciting. And also we're going to see areas that are specific. Now, there's so many areas, and it's still a new science, but the areas that have been focused on the most in terms of increase in activity would be what we call the prefrontal cortex. And this simply is it's the executive function. It's the ability to think clearly and to make decisions and not be impulsive and to have learning and memory. And we see increases in the cell structure of that area. We see increases in the area of memory, which is called the hippocampus, which is great because we're going to be really having problems in the very near future with a number of people who will be struggling with dementia and Alzheimer's disease. And
so how does nutrition reverse these brain changes, or can it?
Well, I think it goes one-in-one with that when we take and stimulate cell growth, then you need these kind of prerequisites. And the energy in the brain is going to be a key prerequisite of cells healing. And it needs a lot of energy. So for example, we know a lot of people, especially in the addiction field, who kind of go into treatment, they want to change their lives, and they'll begin to go on these diets that are very, very low carbohydrate.
Yeah.
And that is detrimental to a brain that's healing, that particularly prefers to use pure glucose. And so there needs to be a continuous, let's say, representation of glucose in the brain at all times. And what's interesting is that the brain heals pretty much in the stages of sleep we call restorative sleep, which is stage 3 and 4. That's when the brain heals. We know this in terms of the body because it puts out something called growth hormone. But this also is part of the brain. And these areas get larger the longer we're asleep, or as we get towards the morning of awakening. So perhaps the hours of 3, 4, 5 o'clock in the morning is when you need to have carbohydrates available to make the brain able to heal. Well, if people have exhausted their store of carbohydrate, which is the liver, and they have not eaten since maybe 6 or 7 o'clock, there is not a whole lot of energy for healing to take place. So this kind of designing a food plan that provides energy all the time is extremely important.
So that's very, very interesting, and we're going to be going to break here in a minute, but when we come back, I'd like to talk more about that, because I think one of the things that I see all the time, as you said, and especially in eating disorders, of course, is are very restrictive kind of diets that are too extreme in our patients, and obviously may be affecting their ability to heal the most important part of their body, which is the brain. I'm here with my guest, Dr. Ralph Carson, who is an exercise and nutrition expert who works in the field of addictions, eating disorders, and obesity. So, Ralph, before we went to the break, we were talking a lot about nutrition and how it helps to heal the brain. Can you just mention a little bit about how this affects our patients who are struggling with obesity, whether they have binge eating disorder or just obesity for other reasons, and how, being on the diet treadmill and some of the diets that are popular, how they might have an effect on the brain?
Well, I think that, as you begin to view these patients as a combination of behavioral as well as nutrition, that they do have different brains. This is the kind of interesting thing that, people beat themselves up because they have trouble controlling the intake of food. And when we actually look into the brains with these scans, we'll find that many of them, and I hate to use this, that it's exactly the same thing, but there are similarities in the obese population, particularly ones that cannot control their intake, with people who are addicts. And the key area that has loomed big in terms of when we look at the brain, it's an area that we would call the reward center, the motivational center. What drives us? What gives us the urge, the cravings? And this would be an area that's called the nucleus accumbens, and it works primarily on this reward hormone called dopamine. And what has evolved over, it's now 20 or so years, is that when we look at these areas on people who are obese, there are fewer receptors. And the term that's used is a reward deficiency syndrome. And so what happens is that they need more dopamine to get that excitement, to get that feel-good feeling.
And we see that with addicts after they get sober, that they often don't get reward or get that feel-good feeling from the same things that other people do, right?
Right. And so therefore you might, say there's a cross-sensitization, or people call it cross-addiction, or a dry drunk, because basically there is no change in their brain if they haven't gotten this area in balance. So as people get this urge, the types of things that they crave is a kind of an interesting observation. It's not necessarily people want to think it's sugar or it's a particular chemistry, but it actually has to do more with the sensory input. And we've learned that the types of foods that people crave are foods that go under the heading of contrast effect, and that's a simple concept. It means that foods quickly change their form.
Their reward,
or no, actually the form. So, for example, if you could have a food that quickly goes from a solid to a liquid to a gas, so you're stimulating the texture and the mouthfeel as well as the taste as well as the smell, then you've got incredible input that indirectly goes into this reward area. So if you say, what are the foods we crave, you wouldn't say we crave table sugar maybe, but you would say it would be like chocolate or Oreo cookies or French fries or pizza or chips. And you'll see that those foods very quickly go through this whole series of sensory inputs, so we call them contrast foods.
But interestingly, I mean, a lot of people do say they crave sweets or they crave salty foods, but all of these foods that you're listing here have that contrast effect. So it's not just the sweets or the salty, but some of the studies do show that sugary foods have an effect on the dopamine reward center.
Well, I think that what we have to be, I'm finding, because I want to kind of follow that through, is that we're finding that definitely in the studies on rodents or rats, but it's not as clear when we kind of begin to take this as humans. So when we begin to kind of break it down in terms of tolerance and withdrawal, it becomes cloudy. Now as we continue to research this, I think we might find that, and it's going to be a certain percent of the makeup. So if you have this sweet component, now it's very interesting when you look at just the concept of sweetness and you look at this area of the brain. I think there's two key things that we have to look at. Number one is why is the brain designed this way? And we're looking at this from a survival or Paleolithic concept. And it's believed that this reward is necessary to make us seek out food, and that we find
and to risk the danger in the Paleolithic times that we had to risk to get to food.
Right. So when you think about sweetness and what that does for the brain, two things. One is it means it's safe. And that's important, because if we've taken something that's not sweet and we're not knowledgeable, then it could be poisonous and cause problems. So as soon as the sweet taste buds are all lining the tip of the tongue, the outside portion, so that's the first to get the cue that, okay, this is safe to eat. The second thing, which I think is fascinating, is they're beginning to do studies, and these just recently came out, that they're looking at the endocannabinoid system. Most people would know this if they know about marijuana. So marijuana causes people to have munchies. And what stimulates this particular reward response is actually fat. So in Paleolithic times, if people came across food that was fat, it meant, okay, store it up because you don't know when you'll eat again. So you get this kind of endocannabinoid response to the brain that says, eat up, eat lots of it. And so you have this combination of cravings for fat, specifically in the endocannabinoid system, and then you have this craving for sugar that can happen more in the sense of the opioids. Those are things that basically are the anticipation of food. And you put them together, and we find that human beings are designed not to necessarily crave pure sweet, not necessarily designed to crave pure fat, but almost a combination of the two.
Okay. And most sweets come along with fat, so that works just fine then.
Exactly. If you look at the fast food industry, they have done a great job of figuring this out. In other words, I call the food industry almost sort of like the sex industry. You take out all the bad parts and you just leave the good parts.
I don't know if the food industry would be happy being compared with the sex industry, but
But there is a similarity in terms of we
but
take
there's
out the
definitely
fiber.
a similarity. Yeah.
We take out the fiber, we take out the things that don't taste good, and we just leave the fat and sugar behind.
Yeah. So one of the things you say in your I think in the intro to the book is body-mind oriented therapies can be very effective at addressing early trauma and sexual abuse as well as addiction and eating disorder behavior. So how do these types of mind-body therapies help with the things we're talking about, like cravings and behaviors of addiction and overeating and so on?
Well, I think that what we begin to do in our thought processes, let's just take, the spirituality component, and we look at what I alluded to earlier, that the brain is going to change. The unfortunate thing is that from doing things over and over again, or that perhaps we're wired a certain way, just because we make up our minds, we say, okay, today I'm going to change. I'm not going to eat this food. I'm not going to behave this way. The brain doesn't change no differently than your computer will change. And I like to use this analogy. Let's say we go to our computer, and we are going to write a letter. And we're going to write that letter. We'd like to write it in a font that's Arial, and we want to write it in a size that's 10. We start writing, and it comes up Times Roman font, and it comes up size 12. So we go into the computer, and we change that, and then we write our letter. We come back to the computer. We hope that we can write that letter again in Arial 10, and it keeps coming up Times Roman 12. So that's what happens in these particular populations.
But you're saying the brain change lags behind our motivation.
Right. And there has to be a period where you get the information, and it has to be authentic. You have to believe that information is true. It's not going to be like, okay, you said so I'll just change my brain. It has to be you have to believe that that information is authentic. You connect with it. It's genuine. Then when that brain actually changes is during certain periods, and we see that it changes, or the plasticity changes during certain periods of sleep. And it particularly changes when you get into wave patterns that we call gamma wave patterns.
And tell me a little bit more about the gamma wave patterns.
Well, gamma wave is sort of at that state, and I'm simplifying this, but I like to think of it as we have a conscious state where we're very aware, and that's sort of where we're aware of everything. That's when our minds ruminate. We think about a problem, and we just go in all different directions. Then we have a state where we're unconscious. We are not aware that we're thinking. Somewhere between that conscious and unconscious state is a state where we're just aware. We're not challenging, we're not analyzing, we're not interpreting. We're just listening to ourselves think.
So it's like an observer state?
Right. So it's kind of a thoughtless awareness. That's how they sometimes term it, thoughtless awareness. And it is during this phase that we see the gamma waves. And so a lot of times you'll hear people refer to this when we talk about meditation or yoga. You'll hear them talk about this as a state that is in synchrony. I'm in harmony. Everything is right. So when you look at a gamma wave, it's very synchronous. It's basically the same amplitude or height, and it's the same rhythm. And so that it's at this particular state where you listen to yourself think that the brain rewires itself. It sets that default mode, so it's always going to be Arial 10, and we begin to actually change our thought processes.
So that's why sleep is so important, especially for weight loss too, but also you're saying for behaviors then.
Right. So the person has to, if they're going to change these bad habits, and it's going to be changing their brain so they're developing new pathways, they have to have this information which they want to change, that they agree on what is valuable in their change, and then when they sleep, then this whole brain begins to rewire itself, so now it becomes something that is part of them as opposed to something they have to white-knuckle and do moment to moment rather than it has more permanency.
We just have a half a minute before the break, but is there any information about how long it takes for these changes to actually happen? I know in preventive medicine we say it's 3 to 5 years to make a behavior change. Can you just give us a number?
Well, I'm afraid that what they're looking at so far in terms of these permanent changes is, at least in the addicts, it's 2 years.
Okay. Yeah, that makes sense, though. So my guest today is Dr. Ralph Carson, and Dr. Carson is currently employed and on the Speakers Bureau at Remuda Ranch Eating Disorder and Anxiety Treatment Center, which is in Arizona. And he has a new book coming out soon, which is called The Brain Fix, Healing the Brain During Recovery from an Addiction or an Eating Disorder. I think that's going to be a really exciting book. When is it due to be released?
Well, of course, we're in the process of, I've written the first draft, and it's being edited, and the due date to have everything completed is October or so. I'm suspecting that it'll be available in November, December, unfortunately.
Yeah, well, it sounds like it'll be a much-needed book. So we were talking a little bit about making permanent changes, and you said that some of the research shows that to make a permanent change with the addicts, it's about 2 years. And, many of them don't make it to 2 years. Is there any evidence to support the use of mind-body therapies and nutrition in speeding up that time frame at all?
As you are well aware of in research, it's always so difficult because there's so many confounds in this whole process. Is it due to nutrition? Is it due to the particular program they went through? Is it how many times have they gone through recovery before? I think what's going to happen, we're going to have a great deal of better input as if we can kind of get more numbers in terms of looking at the brain changes. I would love to see a time where someone goes into treatment and we take a picture of particular areas that we know change, and then have some just go through the whole process without doing any of the things we're suggesting, and have other people go through with this integrated approach. And I think that we'll see definitely changes, but we're not at that stage yet. I do know that a big problem we have with helping people in terms of recovery is to make their program, to make them connect with it. And what I'm finding as I work so much with patients all around the country is that it's just such a window for people to get it, so that they enter into really being committed to their recovery once they kind of can see it. A lot of people, some of the terminology that's used, like I always use as a focus, what is a feeling? How do you know if someone's happy? And I think what is kind of neat in the field of neuroscience is we can actually look at what happiness looks like. So I'll throw out
in the brain on brain scans, you're meaning?
Right. So a great example of this is people will say, well, happy is just like a smile. Well, it's kind of neat in looking at the data on a smile. There's a type of smile that's called the Duchenne smile, and this is an authentic smile. And then there's a contrast that they call the Pan Am smile. And the Pan Am smile is like the old stewardesses on the planes would always smile as you get off, but basically it was a fake smile. So you really sometimes can't tell by appearance. And so what they look at is that, for example, is they look at the left prefrontal cortex, which many of the researchers on meditation look at joy and happiness. So that really, if you looked at what maybe a high school student that's sort of into themselves might say, I would be happy if I had a lot of money. But nothing lights up if they're given lots of things in their left prefrontal cortex. What's working, of course, is the very primitive part of the brain where dopamine is being put out in the limbic system or emotional center. However, if you look at people who really experience compassion, then their left prefrontal cortex lights up. So basically, compassion is happiness, money is not.
Interesting. Oh, my gosh. That destroys a lot of my preconceived notions then. Well, we've been talking a lot about nutrition, and I don't want to miss talking about some of the other body-mind therapies. But I just had one last question about nutrition. I know Kenneth Blum has done quite a bit of research in the use of amino acids to impact the brain. And what are your thoughts about that?
Well, I've seen a lot of Dr. Blum's work, and actually I'm looking forward to kind of doing some research with him on some genetic studies and looking at the different amino acids and the work that he does. I'm impressed to kind of follow this along in terms of having precursors, certain things that make these neurotransmitters, and it can affect the balance. And again, I think it's balance. I think this concept of amino acids has to deal with not just one particular megadoses, but looking at the whole array and making sure that there's this balance of all these neurotransmitters. So I think it shows great promise, especially that there's...
And he uses it for treatment of addictions and there's been some also application in other areas. So, but let's move on to talking a little bit about the effects of yoga on recovery and Tai Chi on recovery from eating disorders and addictions. What does the research say about that?
Well, what I really like to do is I think it's kind of neat because I'm, of course, coming from this scientific background that kind of is a little bit different than the background of people who necessarily come from the Far East and practice this. But if you break it down, and it's a great model for body, mind, and spirit, and you break down into the body where you're dealing with these postures, I think it helps a person to really begin to be mindful of their body in a sense that people have a real problem with their self-image can really relate to, kind of letting go of what society says and begin to get in tune with their body and think.
And you're talking about the yoga postures, also called asanas, right?
Exactly, right.
Okay.
And I think that and they've even made correlations in terms of, like, you will have the anorectic who basically is very rigid and in very restricted posture, and that in doing these other postures, like say they'd have a posture called the cobra, like you can picture a snake just opening up. It kind of allows them to kind of feel what it's like to kind of let go, and in that moment where it's non-judgmental. The other thing I think is that a lot of recovery has to do with this concept of having energy. And when we find that people internalize stress, then they're going to have musculoskeletal contractions and they get very tight. And when you begin to kind of feel your body and loosen up, it's that loosening up and carrying around that looseness with you that gives you energy and re-energizes the body. So it's not just if people have pain, it's emotional pain as well as physical pain. So they can really, when we use some of this terminology in terms of let it go, they can really kind of sense the difference in that moment, what letting it go feels like.
Well, I know there's some research that shows also that yoga not only helps with depression and anxiety, but also for obese patients can help with glucose intolerance and insulin sensitivity, so actually might help you lose weight. But are there other health effects of yoga that are applicable to addictions and eating disorders?
Yeah, I know that specifically the ideas of let's say in terms of eating, this sense of you're feeling yourself, and you put in the context of I feel myself getting more flexible and looser, but they also get a sense of getting a feeling of what emotional hunger is versus basically eating because I'm really physically hungry. And so there becomes that kind of attunement and mindfulness there that I think is helpful. I think that also we talk in terms of this idea of life force, and I know that people hear the terminology of meridians and chakras. I like to think...
And chi.
Right, and chi, right, and these things. And I just have a little difficulty kind of presenting it in terms of the scientific community because these things are hard to measure or to be able to document. But I like to think of it as the breath, and the breath meaning that basically getting oxygen to the tissues and exchanging it. And that as you learn to kind of learn how the breath and gives you energy, it kind of helps you kind of let go of things also. And I think that that's very powerful in terms of recovery. And then that this life force also is kind of neat because when we talk about trauma and you talk about controlling this emergency system, either fight or flight or freeze, and the psychic numbing, so no information is going to get through because as soon as you say something that's traumatic, I shut off my brain, you begin to have an avenue where people can learn to kind of let go and take in information. So that breathing and concentrating on the breathing helps to kind of be a tool that they can immediately connect with that moment that kind of they can enter into listening to information and accepting it. I like to think of when people are nervous, that as soon as they breathe, their stomach goes in when they inhale. Well, that's totally opposite of what their brain needs, because when the stomach goes in, then you're basically pushing your diaphragm up, and you can't take in oxygen. So what you want to do is just the reverse. Have your stomach go out and have your diaphragm go down so you can take in oxygen. And if you get good exchange of oxygen, it kind of calms the vagus nerve. Now, the vagus nerve is key in terms of the parasympathetic nervous system. That means the rest and digest, the kind of calmness that kind of puts it at ease. And so you have this real kind of nice connection instead of just saying words, relax. What does relax mean? Now you kind of show them what it feels like in terms of breathing, then they can begin to make this connection, and they can immediately calm down. So we use this a lot with athletes. As you can imagine, an athlete, let's say a golfer, golfers on the golf course, they do well playing with a bunch of friends, but now they're going to be professionals. They're going to be, this putt is worth many thousands of dollars. The people are watching them. So they can dissociate themselves from that stressful moment by basically focusing on breathing and the breath, and it calms them down, makes them focus. And so if they can improve in sports, we can get people to kind of de-stress themselves in the moment, which they need to do quite frequently in life.
That's wonderful. There are other health benefits of yoga, too, in terms of cancer and some other diseases, right?
Oh, I mean, pretty much anything you can mention. So if you go over the long list, risk factors, things like you said, blood pressure, heart rate, cholesterol levels change, something we call insulin resistance, which basically is helping people control their blood sugar. And then you have this area which is complicated, but it's kind of interesting. We talk about heart rate variability, that there's actually a change in the rhythm of the heart as you kind of get excited and don't get excited. And this is kind of an indication of how well your heart's functioning, and that changes as a result of yoga. You also see it's improved sleep. So here we are trying to get people to get more sleep, better sleep, quality sleep, and yoga significantly helps in terms of reducing insomnia. In the addictions world, we have many people who struggle with pain and get on pain medications. That's almost the number one addictive substance there is now, prescription medications. And it's incredible how people can help themselves with chronic pain through the elements of yoga. Breast cancer, longevity, probably isn't something that you can't probably relate to the benefits that you could get from reducing stress, reducing inflammation with regards to yoga.
So we've talked about some of the mind-body therapies such as yoga, but what about some of the touch therapies like acupuncture or massage? What are the benefits that you see for addictions and eating disorders, and also if there are any benefits that you know of for treating trauma? We just have a couple minutes, so we could get started before the break and then continue after if you have more.
Well, I think that, as we begin to really research this, and instead of looking at it as a peripheral science, or we really kind of get down to it, that one of the most fascinating things that kind of opened my eyes to touch is that if you injure, let's say, your hand, that instinctively what you do immediately is you touch it with the other hand. And so we are innate in terms of the need to touch, even if it's self-touch, in order to kind of reduce pain and to get soothing and self-soothing and so forth. And so that when we look at other people touching, it's sort of it's an actual skilled profession in terms of helping people to kind of feel comfortable with touch. The need that touch is important, the need of other people is important. A really neat study is where people were given an irritation or a blister on their heel and it caused pain, and that the level of pain, which was measured as muscle contraction, reduced when the woman touched her husband's hand.
Oh, but my goodness. That's so well, and intuitively, it makes a lot of sense. I think the problem is proving it in science. My special guest today is Dr. Ralph Carson. He has been involved in the clinical treatment of obesity, addictions, and eating disorders for over 30 years. And we're talking today about how to reset the addict or eating disorder patient's default mode through mind-body therapies. So we were just talking before the break about touch therapies. Is there any research to support massage and acupuncture in treating addictions and eating disorders? I know a little bit, about those, but I wondered, besides things like treating depression, does it have a direct effect on recovery?
Oh yeah, there it's just starting to be, but even dating back to the late 90s and the early turn of the century, that there has been significant studies with bulimia, and they do these studies where they have scores or psychometric measurements where they pencil and paper, but they're called eating disorder inventory scores. And when massage therapy was used, and just in 5 weeks, there was significant reduction in those scores. And the nice thing is now we can actually measure certain outputs by microdialysis of certain chemicals like endorphins, and we see that there is a significant increase of endorphins, which are basically the body's painkillers. So both for bulimia and anorexia nervosa and binge eating disorder, there are some, let's say, preliminary studies that are very encouraging. And when they're encouraging, that means others will take up the job of continuing those studies. So it's very exciting. The problem is in long-term studies, which we always always want to have, and the longest that I have am aware of is maybe a year. So
that's pretty good, though, in research. I mean, some of the studies on medications in bulimia and anorexia are shorter than that. So
right. But
what about acupuncture?
Acupuncture. Now, this is. I understand acupuncture, and I'm all for it. But the one study it's always referred to. In fact, there was two of the same thing where they gave people a pain medication, and then they gave them acupuncture, and giving them something called sham acupuncture, where you just place needles. There's nothing accurate about it. And then they looked at the differences in pain, and they found that the ones that had the most improvement were the sham acupuncture. Second was the acupuncture, and the third was the medication. So I think we've got a lot more to do in that area to kind of be able to, be able to confirm what changes are happening. There's a lot of good studies out there, but I just think that that's the one that I've always hear and everybody wants to relate to is the sham acupuncture.
Yeah, and I think the acupuncturists will say that sham acupuncture is really impossible. If you're putting needles in the body, you are changing the energy flow in the body.
And that's probably what the findings will be, because it's very interesting to look at those studies, and they're actually were conducted fairly well. So
yeah, so they're good studies, but I think it's, as an integrative medicine physician, I know that's an issue that always comes up in research on, even on herbs. When we look at some of the research on herbs and vitamins, it can be very difficult to sort out the results. So I wanted to also ask you if there's any research on the effect of body-mind therapies on preventing relapse.
Well, like I say, I think right now the studies I'm aware of are pretty much just going out and following people up for the longest I've seen in some of these things is for a year. They're doing some pretty good long-term studies in what they'll call mindfulness as far as eating behaviors and mindfulness type of therapies. But the other ones, it's just good to see that there are studies being done to show that.
I know that there's some studies on Vipassana meditation and reducing relapse in alcoholics who were incarcerated, I believe.
Okay.
I'm not sure if you're familiar with that, but there were a couple that I've seen that show that meditation might help even after you are sober and to help prevent relapse. So I think all of that's very encouraging.
Well, since you hit on the treatments with the amino acids, there's some actually 2 or 3 good studies in terms of using amino acids in relapse with addictions too.
And is it oral amino acids or the intravenous ones?
Okay, those were done in the intravenous that I'm familiar with anyway.
Okay, so using intravenous amino acids such as things like tyrosine, tryptophan, is that kind of...
Right, and phenylalanine.
For people who don't know what the amino acids are that we're using.
Like, and I think an easy way for them to understand a little bit is that these chemicals that communicate from cell to cell called neurotransmitters are called monoamines. And a monoamine is a single amino acid. And amino acid makes up a protein. So just like letters make up words, amino acids make up proteins. You take a single
so when
one
you
of them.
eat something like chicken or turkey, when it comes into the body, it is broken down into amino acids such as tryptophan and phenylalanine and all of those. And using these amino acids intravenously, there's some centers that are actually using it to help people detox from drugs and then continuing to use it to help prevent relapse. So we have a few minutes left, and I just wanted to ask you, is there a favorite breathing exercise that you have that we could kind of teach our listeners?
Right. One that I like is what I just call abdominal breathing. And so let me just kind of at least virtually talk you through it.
Okay.
What you will do is you get into a relaxed position wherever you are. It'd be best if you were sitting in a chair and it's somewhat quiet. And what you're going to do is you're going to place the tips of your middle fingers together over your navel or over your belly button. So the tips of your middle fingers are just barely touching. And then what you're going to do is you're going to take and breathe in. But you're going to breathe in, so as you breathe in, the stomach will go out and your fingers will separate. So what we'll do is we'll breathe in a count of 4 very slowly. Breathe in, 1, 2, 3, 4, and hold it. And then we're going to exhale, and we're going to do this exhalation through our nose, and the fingers will come back together. And we're going to kind of breathe in until we basically can't do any more, but we're not going to do it forcibly. So we're going to do that for probably 60 seconds, and everybody relax. And if you took your pulse and measured it and you took it after a minute, you would see that it goes down. So it's kind of a neat little thing to calm yourself down immediately. So I'll just kind of talk people through it, and the first thing is to just get comfortable, your eyes closed, and then place your fingers together over your navel, and slowly breathe in. Your fingers will separate. 1, 2, 3, 4. Hold it. And now, exhale through your nose, stomach goes in, fingers come together. Inhale, stomach out. Hold. Exhale, stomach in.
That's a wonderful exercise. So I know that the trick to breathing exercise, having any benefit, is to practice it. So I hope that our listeners will get a chance to do that. I'm sorry to say that's all the time we have today, but I'd like to thank our guest, Dr. Ralph Carson, for being on the show and talking to us about healing the brain from addictions and eating disorders, and about mind-body therapists. Next week on the show, my guest will be Isabel Tierney. She's a psychotherapist, and she will be talking with us about emotional eating and soulful eating. So join us next week on the Vital Life Radio. I'm your host, Dr. Carolyn Coker-Ross. I'll talk to you next week, and until then, I wish you good health and vitality.
You have been listening to the Dr. Carolyn Coker-Ross Show. Please visit CarolynRossMD.com. That's CarolynRossMD.com to access podcasts, show archives, and more about Dr. Ross and her services.